Hello, this is Dr. Joe Ventura. I've been performing and teaching microcurrent facial techniques for over 30 years. I was personally trained by the staff of Dr. Thomas Wing, the person generally credited with developing the muscle toning and relaxation techniques that have led to the facial rejuvenation industry. His technique was simple. With the right equipment, you can tone muscles that will gently tug at wrinkle lines to reduce them, and relax certain muscles to reduce wrinkles. 30 years later, virtually nobody is teaching it the way it was originally performed. Today there's a hodgepodge of facial movements with wands and Q-tip probes that have no real purpose except to waste time. I've selected several different techniques shown on various videos. If your technique looks like any of these, you're not getting the results you and your clients deserve. It's important to understand that toning the facial muscles happens in a very specific manner, and it never involves wand movement across all of the muscle groups in all different directions. That is counterproductive, and it really defies the physiology and the anatomy of the facial muscles. With this technique, you'll see probe movements that seem to have no real purpose as far as muscle toning or relaxation goes. You'll see movements in areas where there are no muscles, movements where they go across the belly of the muscle, and in virtually every case, movements that engage too much of the muscle. All of these types of techniques really are just a waste of time and will not produce the accurate and dramatic effects that you're looking for. And this is yet another technique where we're using large surface area wands to stroke in long, deliberate directions toward the eyes, which is a common mistake that we see in most techniques. When you're doing this kind of deep tissue stroking, you need to be moving down toward the heart area to disperse any of that interstitial fluid and promote lymph drainage. But again, this technique appears to have no real purpose and is crossing too many muscle groups at one time. Here we have a technique where the operator clearly isn't understanding the facial muscle anatomy. The direction of these strokes are designed to relax the muscle, and that's the last thing you want to do in this area. All of these techniques that you're seeing on the screen, this company is moving the probes across muscles, across the belly, and in an absolute incorrect direction to promote any toning in the facial muscles. What we've seen in the majority of these videos is a basic lack of understanding of muscle physiology and facial anatomy, and simply moving wands around with microcurrent stimulation coming out of them. Now, if all of these companies doing all these various techniques are getting results, imagine the results that they could be getting if they were performing the technique as it was originally developed. We use the original techniques as developed by Dr. Thomas Wing. We understand the physiology of muscle contraction and relaxation and understand the facial muscles. Our technique is all about economy of movement and getting the desired results quickly and accurately. Our training method is second to none. We encourage you to ask us more questions about the seminar training that we offer in the original art of facial rejuvenation. We'll be happy to help you. Thanks.